Senate Committee on Health Education, Labor, and Pensions will please come to order. I'm a doctor. I've seen how technology is improving Americans' health. More accurate diagnoses, fewer procedures. When was the last time anyone had to do an exploratory surgery? Which people below a certain age don't know what that is. Before you had CT scans, you would just open up a belly and look around, causing all sorts of problems, causing future surgeries. Now, the federal government has invested billions in technology, and a good example is the electronic health record, and now AI is being implemented in healthcare settings. With these new technologies, however, we must address the threats of cyber attacks and loss of control of sensitive information. There were more than 730 cyber breaches last year, affecting over 270 million Americans, including the attack on Change Healthcare, the largest healthcare cybersecurity incident in history. This attack exposed the data of over 190 million people, leading to significant delays in care and in electronic prescribing. Further delays in claims processing resulted in billions of delayed provider payments, bringing many health practices to the verge of bankruptcy. To ensure patients fully benefit from the advancements in health technology and are not harmed, Congress must work with healthcare entities to improve resiliency against cyber attacks. I introduced legislation with Senators Maggie Hassan, John Cornyn, and Mark Warner last year to address these challenges, and I look forward to working with President Trump and my colleagues to advance this legislation through Congress and get it signed into law. Beyond cyber attacks that threaten Americans' health, we must also harness the power of big aggregate data and artificial intelligence while preventing the misuse of patient data. The Health Insurance Portability and Accountability Act, HIPAA, has been effective at protecting clinical information for decades, but the law has not kept pace with new technology or with innovative tools like wearable devices and apps that are now an essential aspect of healthcare. Many of these tools are directly marketed for health purposes, yet consumers are unaware that this data is not protected by HIPAA. Rural providers are also unable to best use the data collected via electronic health records to deliver personalized care, given the significant barriers to aggregating and analyzing de-identified clinical data or other health information. Currently, Americans have few legal protections and control over their health information captured by devices. Sensitive data can be collected, batched, and sold by data brokers to any buyer on the market, including geopolitical adversaries that can abuse this data for nefarious reasons. Last Congress, I published a report outlining proposals to empower patients to control how their data is used. This includes modernizing HIPAA, as well as safeguarding health data not covered by HIPAA. I'm also working on efforts to better leverage AI in healthcare and to assist rural providers with finding value in the population-level data that is available. I look forward to discussing these proposals with our panelists today. Thanks to all of our witnesses for being here to share your ideas on the above topics. With that, I recognize Senator Sanders.